Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Vaccinations have done away with most of the diseases that at one time proved deadly. In order to be effective, they have to be administered. So where do you stand on vaccinations? Today we'll talk about vaccines and their value, and hopefully along the way we'll even dispel a few myths. I'm Janet Whitmoyer, your host. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. Stay tuned. My first guest is a pediatrician with Helena Pediatric Clinic. She's here to talk about some of the conversations and concerns surrounding vaccines and to dispel a few misconceptions about vaccines. Welcome, Dr. Erin Keefe.
Thank you.
Let's start off today by talking about some of the concerns people have with overloading a child's immune system by getting multiple vaccinations at the same time.
So children, even from very infancy, are well tuned. Their immune systems are very capable of having more than one vaccine at a time. We give multiple vaccines to infants because that's when they're most vulnerable to getting the diseases. So those that choose to decide to delay vaccinations are really putting their children at risk of getting the diseases that we're working so hard to prevent.
Oh, so getting vaccinations early is important.
Getting vaccinations early is very important.
Okay. And we also hear a lot of concerns from people about a link with the measles, mumps, and rubella vaccine and autism. Can you tell us, is that a viable concern?
That is not a viable concern. There was a study that was published in Lancet in the late 80s that studied 12 children that suggested a link between autism and the measles, mumps, and rubella vaccine. That study has been disproven. And there was fraudulent research, and in fact the lead investigator lost his medical license in Great Britain because of that research. Subsequent research and studies have shown no link between measles, mumps, rubella vaccine and autism.
Oh, thank you for clarifying that. There are a lot of people that are concerned about mercury in vaccines. Do vaccines contain mercury, and if so, is it potentially harmful?
So a lot of vaccines used to contain thimerosal, which is a preservative which has mercury in it. Okay. And most of those have been taken out of the vaccines. The influenza vaccine is the only vaccine that still has some thimerosal in it, and only in the multi-dose vials. If you get a single dose vial, it does not have thimerosal in it. All the children's vaccines since 2000 otherwise have not had thimerosal in their vaccines.
Oh, wonderful. So let's talk a little bit about the flu vaccine. We hear people who say they don't want to get the flu vaccine because they're afraid that it will actually give them the flu. Is there any truth to this?
That is not true. They will not get the flu from the vaccine. It is an inactivated vaccine, and you cannot get flu from the vaccine. There are some side effects. You can have a sore arm and maybe get a little bit of a fever, but you will not get the flu from the vaccine.
Okay, so if I were to get a flu vaccine this year, would I need to get a flu vaccine again next year?
Yes, you would still need to get one next year. The flu is a very smart virus, and it keeps changing, and so we need to keep adjusting the vaccine to so that it will work each year.
Okay. The other thing that we hear a lot about is concerns with the egg protein in the actual flu shot. Is there any reason to be concerned about people who have an egg allergy with getting the flu vaccine?
So most people, even if they have an egg allergy, will do okay with the influenza vaccine, but they should talk to their doctor if they have an egg allergy, because some people with severe egg allergy should be tested or avoided.
Okay, great information. So I have one last question for you. You've given us quite a bit of great information, and if we want to find out more, is there a resource that you can direct us to where we can get credible information on vaccines?
I would say the best source is the Center for Disease Control. The CDC has a website, cdc.gov.
Okay. Is there anything that in your local community a physician may be able to help direct people to get information on flu shots or other vaccines locally?
So locally, obviously, all the physicians that give vaccine were actually required to give a pamphlet that the CDC puts out. So all the offices should have good information about all the vaccines, including the flu vaccine.
Okay, that's great. Also, maybe asking another question about the pneumonia vaccine. A lot of people are asking about getting the pneumonia vaccine. Is that possible to get the flu and the pneumonia vaccine at the same time without any complications?
Yes, you can get both at the same time.
Okay, so people don't need to worry about that.
No, that is not a concern.
Okay, thank you, Dr. Keefe. You've provided us with some great information on vaccinations, and I'd also like to thank you for being a guest with us today. Next up, we'll get a pharmacist's perception on the importance of vaccinations. We'll be back right after the break. My next guest is Lisa Sather, a pharmacist with Mountain Pacific. Welcome, Lisa.
Thanks, Janet. Thanks for having me.
You bet. Let's start off by talking about the safety of vaccines. There's a lot of back and forth. Can you tell us, from your perspective, about the safety of vaccines?
Yeah, that's a great question. So I think it's important for our viewers to understand that the FDA is responsible for the safety and efficacy, the effectiveness of the vaccines in the United States, as well as the availability. And I think our viewers can be confident to know that the United States currently has the safest and most effective vaccine supply in its history. So that's super important. Just a little bit of information for folks to understand. Before a vaccine is ever used in humans, development begins in a lab, and we conduct studies then on animals. And if it is deemed to be safe in animals, only then are studies conducted on healthy volunteers. The FDA is responsible for overseeing this process, and they do hold the studies to the highest ethical and clinical standards, scientific standards, to make sure everything is done appropriate. And only then, if a vaccine's benefit is expected to outweigh its risks, is it released to the public. The FDA issues a license, and then it's available for a URI to receive. So I think everyone can stand and be confident to know that they are safe.
That's really reassuring to know. So can you tell us why healthy adults require regular vaccinations?
Yeah, that's also a great question. So I think a lot of folks don't understand that approximately 50 to 70,000 adults die each year just from complications related to the flu and pneumonia. And that number could be drastically reduced if everyone would get vaccinated. So that's really important. Based on policies developed by expert groups like the CDC, it is recommended that all healthy adults do get vaccinated. And especially those who have chronic conditions, it's really important because they can really suffer from consequences from getting one of these vaccine preventable illnesses.
Well, you've convinced me to get my vaccination. So once we all have become vaccinated,
Yes.
Can you tell us what some of the common side effects are or complications with vaccinations?
You bet. So, typically, as you know, if you've received a vaccine, you might develop a little red sore spot at the site of the injection. Some folks might get a mild fever, a rash, rarely joint pain, and those kinds of things. But typically there is a very, very rare instances where somebody might have a very serious reaction like an anaphylactic or shock-like reaction. I will tell you this, from a pharmacist perspective, the science behind vaccines still recommend that the benefits completely outweigh the risk of a serious side effect occurring.
Okay, so would there be any circumstances when really a vaccine should be avoided?
So yes, based on some specific age groups as well as some health conditions and for some other reasons, really too lengthy to kind of get in with this show, there are some situations in which a vaccine should be avoided or folks should wait to get a vaccine. And what I would recommend is you visit with your physician, your provider, or your pharmacist. As we know, your pharmacist can administer a lot of these vaccines for you, so they'll be able to give you all the information you need in order to determine what's right for you.
Okay, great. So there's people that are taking many different medications. Is there any worry for them if they're taking multiple medications for also getting an immunization?
Yeah, that's a great question. We do know a lot of folks, especially some of our older folks, are on a lot of medications, and really there are some very uncommon medicines that might interact with a vaccine and really not cause any harm to the person per se, but they might reduce how effective the vaccine is for them. So really, they're not very common. I would suggest, again, talking with your pharmacist or your doctor, and they'll be able to help go through those medicines with you and assure that your vaccine is going to be as effective as possible.
Okay. So the key really is to be checking with your healthcare provider to make sure that it's safe for you to get the vaccine.
Absolutely.
Okay. So we're in the middle of the flu season right now. Let's
Yes.
talk a little bit about flu shots. How effective is the flu vaccine?
So that's a real timely question, because we do now have data from the CDC for this year's flu season, and this year's flu vaccine has been shown to be about 48% effective. That's a really good effectiveness rate, and has reduced the complications related to the flu by half.
Oh, wow.
So that's really good information, and I think it really reiterates how important it is to get vaccinated.
And who are the people that really are at risk for getting the flu?
Sure. So really, there are folks who are at risk for getting higher complications from the flu. Folks that are 65 and older, the very young, and those with specific health conditions like diabetes, heart disease, kidney disease, those kinds of things really are at greater risk, and you want to make sure you get vaccinated.
Okay. And speaking of getting vaccinated, what is the best month to get vaccinated in, and for how long does the flu shot last?
That's something we get asked quite often, because you'll see vaccines available in August nowadays. So really the CDC recommends getting vaccinated by the end of October. It's going to take your body a couple of weeks in order to develop immunity so that you can be protected against the flu. And the flu season typically ranges from December, peaks December to February, but can last as late as May. It is important to know that the vaccine is going to last you a year.
Okay, so if you didn't get it in October, you would still be able to get a flu shot later on and it would still be effective?
Absolutely, there's
Okay.
still benefit there, so make sure you do it.
Okay, so when I go and get my flu shot, is it a 100% guarantee that I'm not going to get the flu?
Well, in a perfect world, that would be true, Janet, but this is not the case. So, no, not necessarily. Really, the effectiveness of the flu vaccine, typically 50 to 60%, and it also is going to depend upon the strain of virus that is circulating that year and how well matched the flu vaccine is to that specific strain that's circulating. So I always like to tell people, yes, you still may get the flu, but you're not going to get it as probably severely and have severe symptoms as you would if you hadn't been vaccinated. Your complication rate may be less, so that's really important to know. And I think it's also super important to let folks know that the best prevention for the flu is getting your flu shot, period.
Okay, awesome. So a lot of people get the pneumonia shot as well as the flu shot. That's really recommended by a lot of physicians. Is it safe to get the two vaccinations at the same time?
That's a great question, and in fact, for our pharmacists that work in the community setting who administer vaccines, that's one of the most common asked questions that they get. So it's absolutely 100% okay to get those both in the same day. So if you go to your pharmacist or your doctor and you think you might benefit from the flu shot, you're getting the flu shot, but you might benefit from the pneumonia shot, ask them, and they'll be able to let you know if you're reasonable to get that, and you can get it the same day.
Thank you, Lisa, for sharing the pharmacist's perspective on the importance of vaccinations, as well as their safety. And thank you also for being with us on today's show. Stay tuned to hear from the Montana Department of Public Health and Human Services on what they're up to regarding centralized vaccination records. Join me in welcoming our next guest, Becky Weiner. She's the Immunization Program Manager with the Montana Department of Public Health and Human Services. Becky's here to talk about some of the efforts the department puts forth to keep our state safe from vaccine-preventable illnesses. Thanks for coming and welcome, Becky.
Thank you.
Okay, so the first thing I'd like to talk about is the program we're hearing about called IMTRAX.
Yes,
is that how you
IMTRAX,
say it?
yep.
Can you tell us about that program?
Sure. IMTRAX is a system which we call an immunization information system, and what it's meant to do is gather everyone's immunizations in one place so that when a patient goes to see a provider, the provider can look up the immunization information and have a better understanding of what that person might need in that day. Also, it puts them in one place so that you can get to them later when you should need them.
Okay, well, that sounds like a great program to have everything consolidated in one area. Are there any other benefits to the program?
Yes, like I said before, what we see often is children don't always go to the same provider. So they may have gotten a set of immunizations earlier from a different provider. It's important for the next provider to know that they received them and when, so that that provider can be sure that they give them their next set of immunizations on time. Additionally, with those in the system, when children decide or parents want to put them in daycare, then those records are easily accessible for them to take them to daycare, and then the daycare providers can make sure that they're up to date and can attend daycare. Same goes for school and college. And then as people start to age, they may need them to get certain jobs. So it's a great place to keep everything. And additionally, sometimes even as adults, we forget what vaccines we've had, right? I mean, I probably couldn't tell you the last time I had a tetanus shot.
Right.
But sometimes when I go to the doctor, they ask me because I'm due for one every 10 years. If they can just look in one place and see that I had received my last tetanus shot just 5 years ago, then I don't need to receive another one.
Oh, yeah, awesome. That helps making us not have to remember so much.
Right.
So do Montanans have to participate in this program?
No, Montana currently runs what we call an opt-in system, meaning that a person has to sign a consent to have their immunizations put into the registry.
Okay. So if I wanted to participate in this, how would I get my medical records into this IMTRAX system?
Many of our providers are already participating in IMTRAX, so if you want your records in there, if you're with a participating provider, they should just ask you when you go, and then if that's the case, then your records should be there. You can always check with your local county health department or even the state to see if your records exist in there, and we'd be able to confirm that. If for some reason your provider is not providing their immunization records to the registry, they can ask for a paper record, and then they could take it again to either the county health department to be entered.
Okay, so you said that many providers are participating. Can you tell us about how many actually are in the program?
Yeah, we have, roughly about 500 people that are authorized to use the system, and not all of those are immunization providers. Some of those, like I said, might be school nurses who might just need to look up records. But as far as actual providers, about 200 to 300 providers in the state of Montana that actually administer vaccines go ahead and submit their vaccines to us in some way.
Okay. So can you briefly tell us about the benefits of having this information in the database?
Yeah, I mean, we look at the benefits in a couple of ways. One is again, for the patient, the consumer, like we talked about earlier, is just having that in one place. The other thing that we can do is we can look at the potential for using the system to remind folks to come back in. As we do know that sometimes that parents may just forget to come back in for certain vaccines. And then we can have just a better repository of that, just to let folks know that they might be falling behind or they might be coming due. So the more information that we get, the easier that kind of thing is to do.
Right, and it would help the program grow, I would imagine.
Yes, yes.
Okay. So how many states have a program similar to what we have in Montana?
All states have a program, and each state has a little bit of a different program. I really do often get asked, like, why don't we just have like a nationwide, you know, like
Right.
tracking of this? And the real good answer is that is because all states are different. Like I explained before, Montana is an opt-in state, meaning that we have to have consent to put your immunizations in IMTRACs. Other states put that in there unless somebody says they want out. So and there's some other legal differences in the way that things work. So all states do.
Okay, and knowing that our population is becoming more mobile, what advice would you have for people that would be traveling across the country or relocating to other parts of the United States?
If people are relocating or moving across the country, we always recommend first that it's always a good idea to know if you're up to date on your vaccines, especially your kids. As we know, traveling and everything can expose you to certain things. You want to make sure you're up to date, especially if you're leaving the country.
Right.
Leaving the country is really important. You may even want to take a visit to your provider, even your local health jurisdiction, your county health department, to find out if the area that you're traveling might have some certain concerns, and to make sure that you're covered for those things before you go. And then also, if you're relocating, take your records with you so that you can have those on hand when you go.
Well, that's great advice to have. So I have one more question that I'd like to bring up with you. We see a lot of campaigns that are targeted towards children and children's vaccines, but what can you tell us is being done to help adults know how important immunizations are for them?
Yeah, you're right. We often see vaccines targeted towards children, and one of the things that we'd like to get the message out there is that vaccines are for adults too. And so we've been partnering with other outside partners, including Mountain Pacific, to make sure that we get that message out, and that partnership helps us to really get the message out and consolidate our efforts.
Okay, great, Becky. Thanks so much for your great information.
Thank you.
That's it for our show today. I want to thank all of our guests and to remind you at home to stay fit, stay well, and stay healthy for life with Healthy Living for Life. See you next week.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.